So we have two guests in the studio. One of them is just getting in and getting himself comfortable. The other one is already in here. Millicent Kagonga is a cancer survivor, and Dr. Jeffrey Mutuma is a consultant pathologist, a founder and proprietor of the Zambezi Cancer Hospital. I'm going to start with you, Millicent. Good morning.
Good morning.
Thank you very much for joining us. Welcome to the Situation Room. It's the hot seat of the Situation Room, but don't worry. It's Utamaduni Day. So today, we're going with our own Utamaduni, but we'll just make it comfortable for you.
Thank you.
Asante sana for joining us.
Okay.
You're a cancer survivor. Tell us, how many years have you been off cancer?
Wow. Thank you very much for the opportunity. I'm Millicent Kagonga. I'm a cervical cancer survivor, and I'm also the founder of Symbol of Hope Warriors, based in Kariobangi. And my journey, I love starting it the way it is, because I want a lot of women to get the information outside there. My journey started at the age of 14. That's when I got my firstborn. And at the age of 20, I got my thirdborn. And at the age of 20, the same year, I started having this abdominal discharge without knowing, since I was living in the slums, and we didn't have the information about anything about private parts. We were not talking about it. So I started having this abnormal discharge, and I kept quiet for almost 5 years, and until this one day I saw a lady talking about signs and symptoms of cervical cancer, and that's when I decided to open up to a close friend, and I went to do my screening, and that's when I was confirmed that I have cervical cancer.
What stage was it by the time you were getting screened?
By the time I was getting screened, it was advanced. It was stage 4, and it wasn't a good message for me, since in those areas we thought like cervical cancer is or any chronic sickness is the sickness for the other side. Sentence. Yes, not.
You thought it's a rich person's disease.
Yes. So
so when you heard this and you're thinking, surely, how, from somebody living in the slums to be diagnosed with cancer, that's not possible. Did you argue with the doctors?
Yes, I tried to argue with them, but at first it was like a shock to me. I fainted, and then I just decided to kill myself. But I remembered I don't have my kids, and I needed all of us to be gone. Until one day I found out the information. I did another biopsy, and I did my treatment in 2017. So you can see there is a bigger gap, and if I was diagnosed early and I gotten treated, I could have been able to save part of my body, or to save my life. Yeah.
Tell us about this person from whom you heard about cervical cancer and the symptoms that then made you think, let me get myself checked. What is it that they were saying?
She was a survivor. She was a cervical cancer survivor, and she was sharing a journey like I'm sharing like right now. And she was talking about
where was she?
She was on national television, and she was talking about the pelvic pain, the back pain, abnormal discharge, heavy bleeding, and those are the same symptoms that I was having. Yeah.
And so when you went to your friend, is she the one who walked with you through the journey to hospital?
By then I was a house girl. I opened up to my boss. She was so close, and she insisted. I talked to her like at 5 p.m. in the evening, and the next day I was already on the hospital. And the first facility that I went, I was by then 25 years, and I was told I'm still young to get cervical cancer. I did some tests, and I was the doctors, by the first facility I was told it's infection. So they got me the medication. I used the antibiotics, but after 2 weeks I went to another facility and insisted to do the cervical cancer screening.
Mm-hmm. Yeah, because I actually was interested in getting that bit of the number of of health facilities or tests that you underwent by the time they then confirmed that this is cervical cancer? The first time you went, they said, your symptoms and all, you're too young, it's not probable for it to be cervical cancer, so let's just do some tests. And they thought it was an infection.
Yes.
And you were put on medication.
Yes.
The second one where you went and you insisted, what was the initial reaction of the officers in that clinic?
They were not happy because sometimes you see you are just a patient. Yeah, but I'm glad I insisted, and after them trying to do the diagnosis, even they were shocked. I had one of them telling the other one, because there were two nurses, and they start saying like, I have never seen such a thing, and how is she, and she's still young, how can she have this? And they started apologizing. Millicent, we are so sorry, you have cervical cancer stage 4.
The doctor is here, Dr. Geoffrey Mutuma, who's a consultant pathologist and founder and proprietor of the Zambezi Cancer Hospital. Good morning, Dr.
Good morning.
Thank you very much for joining us.
Thank you.
We're just hearing this story from Millicent, and of course we're going to keep getting a lot more of the details.
Yeah.
First, we hear this many times. People who end up being diagnosed with cancer, they end up being diagnosed with cancer after like the 4th, 5th, 6th visit to hospital. Why is it so?
Right. My name is Dr. Jeffrey Mutuma. I work in the Zambezi Hospital, and also I do research in Kemri. I've been doing research in Kemri quite a long time, almost 24 years. So most of the things of cancer, which we discuss about, I've been looking at them for quite a long time. What Millicent says is quite correct, is that the most important thing about cancer in this country is that we need to create awareness. I normally say that treatment is good, research is excellent, but it has no value to us now. What is very important and what we need to focus, if we need to save people from dying of cancer, is just creating awareness. And that's why you find that nowadays, of course, we have talked so much about treatment. Treatment is good, diagnosis is good, but that will not save lives of patients. What you save lives of the patient is just creating awareness. And that's as the Zambezi Hospital, we have taken that as one of the major things we need to do, because creating awareness saves life and saves so many lives. Because what is very important, and we need to know, and then I have to thank Millicent here, because most of the patients, when they are diagnosed with cancer, they don't take action. In fact, they give up, because there's this notion that a cancer is actually a death sentence, which is not. And that's, I'm happy now we are passing this information to our people, is that actually cancer is treatable. And normally what I say is that cancer is treatable irrespective of the stage. And that's why we know, and throughout my experience as a doctor, most as a consultant pathologist, is that 90% of our patients, they come with stage 4. 9%. Very few people come in stage 1 and 2 and 3. Very few up to this time. And that's why you find that when it comes to outcome of cancer, what matters most, it is the awareness, is the stage of diagnosis. Once a patient comes in stage 4, there are two things. First, there is the medical profession, which I do believe that there's a gap in the medical profession, that actually we need, the first people we need to educate most is the medical profession, not the patients. Because I have seen, and of course I see this every day, I mean even today. Today, the patient who rang me today, that he has been managed for a long time as infection. He has got cancer of the prostate. The man is passing urine so many times, and he has been diagnosed like UTI, urinary tract infection, for a long time. And that's why we need to educate, and the most awareness, which will make a difference in cancer patients in this country, it is the medical profession, not the patient first.
That's the question I was going to ask, Dr. Because we're replete with examples of people who've gone to hospital. So the awareness on the side of the patient is highly existent, that there's something going on in the body that obviously is not normal. You take yourself to hospital, you go to check, and somebody tells you, well, all right, it may be an infection. We had a gentleman who spoke to us about a running nose. He had a running nose for years. And every time he would go in, oh, it's an environmental allergy. Next, go back, come back, it's something... He had esophageal cancer, and it was by that time it was stage 4.
Exactly.
So who then must the awareness be built up amongst?
Right.
And I think that's what we're looking at here. Because cervical cancer, you know, I believe it's number 2 in terms of prevalence in Kenya today.
Yes.
But it's also called the silent cancer.
Yeah.
That its symptoms mirror other infections that you would have as a woman. But then if you take yourself to hospital and the diagnosis that you're given is something other than cancer, amongst who then must the awareness then be made?
That's quite correct, and that's what I've said, and I'll repeat it again, is that the most awareness, I believe, is in the medical profession, is us, the doctors, who need to know that cancer is common disease in this country. Of course, you've got one of the things is that, and I remember this quite well, when I started cancer research in Cambridge, people thought cancer is not a problem. And I'm talking about 20 years ago, more than 20 years ago, in fact. But people thought that cancer is not a problem in this country. And I remember those days, HIV was very common and very high. But I used to say, and this was my projection that that time, that by 2025, cancer would be killing more people than all diseases combined. I thought 2025 is very far. We're almost there actually now, because actually cancer is a major problem. And that's why we find that even for our doctors, even for us in Cambridge, we are still focusing on doing research on other things. We are not focusing what actually is killing our brothers and sisters, the cancer. And that's why we find that we need to put a lot of emphasis on disease called cancer, because these are diseases, when it comes to us, when it comes to a patient, it does not go. It's a disease which is the treatment, the diagnosis is a bit complex. And that's why we need to be able to create awareness. And of course, the way I've said, and there's a gap between the public and the doctors.
Is it possible that somebody presents themselves to hospital with some of the symptoms that Millicent was talking about?
Yeah.
And it's possible that you're at stage 1.
Yeah.
And then through the length of these false diagnoses, as what I'll call them, you're able to progress till the next 2-3 stages while having been seeing a medical practitioner. Is it possible that could happen?
That actually the actual thing which happens. A patient knows that she has a problem. And that's what I normally call it lung period. The time when the patient has a problem, the patient knows I have a problem. He goes to the doctor. By the time this patient is put on treatment, it takes almost 4 or 5 years. The patient has a problem. The patient knows I have a problem. The patient go to health facility. By the time this patient start on treatment, there is fourth and is urinary infection. It is something else, and then we start the journey of diagnosis. You take time to do the biopsy. The biopsy is done. It takes 3 months to be reported. It takes time to go to see the doctor. You are referred to one hospital, and then after that, a doctor tells you another story. You have to go back and do another test, and then another doctor does another story, and then you go another. By the time you reach somewhere where you can be treated properly for the cancer of this country, that's where we are losing a lot of patients.
Sounds almost criminal to me. I'm sorry.
It is. And I've seen this long time, and I've talked about this for a long time, and this is exactly what we need to do. And that's why what we need to do is actually the first thing, which I normally like the way the media has done. Media has done its job very well. Our patients know. Our public know. But we have a problem when it comes to management of the patients with cancer. And more so, what's even worse is that cancer is a serious disease. It's not a disease which can be managed anywhere. And it can be managed by anybody and anytime. It needs a real preparation. Like there's nobody with cancer who can be managed by one doctor. Because with cancer, you'll be seen by several doctors. You have to see the physician. The first thing you have to make a diagnosis where you normally have to make the pathologist make that diagnosis. By the time the pathologist makes that diagnosis, the patient has to take that report to, like if having cancer of the cervix, to a gynecologist. The gynecologist has to refer to radiologist, to oncologist. It's a long story. And that's why we find that the treatment is complex, but to reach that stage where you can get and start the treatment, it takes quite a long time. Yeah.
Is it criminal though? Or is it? Because I don't think there's any medical professional who looks at a patient and says, you're likely to have cancer, but nah, I'm not going to deal with cancer for now. Let me start with bacterial or viral infections. Is it that, or is it lack of capacity even in terms of the equipment.
No, it's not.
So you know very well that if I want to start going the full hog of testing for cancer, it's going to cost. I'm not going to start telling Millicent, so the first thing, oh, you've come. And you're saying, backache, all right, the next thing, abnormal discharge, the next thing, hip pain, okay, all right. So it sounds like it could be. So go and start taking these kind of tests, which are going to be very expensive.
Right.
Or is it, so let me just do a process of elimination. Let's start treating what is most likely to be.
Right, you are very right. First, it's not criminal because there are two things. When the doctor makes the wrong diagnosis, that's not criminal.
Yeah.
The only time it's criminal is when you make the right diagnosis and you give wrong treatment. That now you know it. Once you don't know, that's not a mistake of the doctor. Now, something very important is that most of us when we were trained, cancer was not there. So that's actually most of the doctors, is actually now current doctors now who know cancer is common. But people who are trained a long time, we are still thinking about typhoid, talking about amoeba, talking about pneumonia when you have cough and you have got cancer of the lung. Most of the doctors will start talking about TB and pneumonia and things like that. So the first thing it is, the way I've seen it myself, of course, I've been in the field for a bit of time, is that cancer came so fast. Cancer came so fast in this country. So most of us, the doctors, actually, cancer is a second thought. It's not the way we were trained that when a patient comes to you, malaria is fast in your diagnosis. TB is a fast in your diagnosis. Pneumonia is fast in your diagnosis. Cancer used to be somewhere there very, 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 very far. It was far-fetched. And that's why now we have to change that.
So are you saying that it should be in your foremind then, as a doctor or as somebody that when somebody presents with symptoms which have been prolonged, that because of the way in which cancer has developed so quickly in the society, that it should be then amongst some of the first things in your mind as a doctor when these symptoms are presented to you in a patient?
Right. In fact, nowadays, what I'm saying, when a patient comes with anything, maybe cough, sneezing, the first is cancer. The first, which should come to the doctors currently in Kenya, the first thing is cancer. When somebody comes with headache or vomiting, the first thing every doctor in this country should think is cancer. Forget about malaria. Forget about typhoid. Forget about other things. When somebody has constipation, instead of starting to treat typhoid and amoeba, treat cancer of the colon.
But doesn't the length of time matter? Or are all of these things taken into consideration? If I present myself to you and I say, well, I've had this cough for the last 3 months, it's not gone away. I've had this.
So it's a sore throat.
It's a sore throat.
I keep losing my voice every morning because
So then, and I don't have environmental allergies, for example, but I have this tickly thing. So are you saying now over time, is that what you look at? It's not somebody who rocks up and had a fever for 3 days that you're going to say, there's possibility of cancer, but are you looking at the time as well?
No. In fact,
really?
No. With currently, and that's my experience and what I've seen, and because I've really handled many patients who I wish they should have diagnosed early. And that's why I'm saying currently that when a patient comes, instead of thinking the infectious diseases, think about non-infectious diseases, which the first one is cancer. Any patient with any symptoms, and I've seen that, and that's why the way Millicent has said, she went and the doctors and the nurses were thinking something very different, and that's why when a patient comes, irrespective of length of the symptoms and signs which the patient has, the most important thing in this country this time, the first thing we need to think about is cancer, and that will save a lot of life. Of course, if you think about cancer and you find it's not cancer, now it's treating your normal cough and normal allergy, that's okay. But if a patient comes and you think about cancer, you save more lives. What do you call that shift of thinking?
It's the mindset that needs to shift. Let's take a break. It's 29 minutes after 8. Dr. Jeffrey Mutuma is a consultant pathologist. He's a researcher at KEMRI. He's a founder and proprietor of the Zambezi Cancer Hospital. And Millicent Kagonga is a cancer survivor and a founder of the Symbol of Hope Warriors. She's here also with us because it's Cancer Awareness Month. We are creating awareness and discussing about cancer and its prevalence in the country. Time for us to take this quick break.
This is The Situation Room the only way to start your day.
With us in the studio this morning, Dr. Geoffrey Mutuma, who is a pathologist, founder and proprietor of Zambezi Cancer Hospital, and also researcher with KEMRI, and Millicent Kagonga. She's a cancer survivor and a founder of Symbol of Hope Warriors, telling us her cancer journey. Millicent, when you were going through this journey, there's a whole issue that many people talk about when it comes to cancer treatment: cost. Tell us about that.
Wow. That's a great question, and I normally speak for the voiceless. So the cost is too high. At my days, I was to do like 25 cycles of radiotherapy, whereby each cycle was 3,600 per cycle. That is a governmental hospital. A private hospital, of course, is much higher. And also I needed another treatment called brachytherapy, which is so expensive. Most of our government hospital, by then the machine wasn't working. I ended up doing to a private facility at 40,000 per session, and I needed 3 of them. So the cost was too high. I was also to do 6 cycles of chemotherapy, but I ended up doing 3 of them because of the cost of the treatment. By then, NHIF used to be paying like 80% of the treatment, but now NHIF is paying like 40% of the treatment, whereby we are losing more women to the cancer, because maybe you are to do 35 cycles of radiotherapy and NHIF is only paying 20 cycles. So the rest of the treatment, you need to sort it yourself. So the cost is too high, and especially to cervical cancer, we are losing women who hasn't finished their treatment. Like radiotherapy, they can't do the treatment because of the high cost. And it's high time the government to come up and to see how we can take care of our women. Like the research says, we are losing more than 9 women of cervical cancer per day. Those are a lot of women, and those are the women that have already diagnosed. What about those women that we are losing who hasn't been diagnosed yet? So if we look to our research, is that we are losing like 20 women per day. The reason why, maybe the 11 women have not been diagnosed, because even the diagnosis itself is so high. Like biopsy is 40,000 and more than 40,000. Where are you going to get like that such kind of money to do the biopsy? So
even before you start treatment,
yes,
there are all these tests that you're doing.
Yeah.
How many tests did you have to undergo?
This month is a breast cancer month, and a lot of organizational community or civil servant, they are doing like free screening like everywhere. So after that free screening, you need to do another screening, another test like biopsy or the pap smear, so that they can confirm, and the biopsy is the confirmation that this person has cancer. So the biopsy itself is so expensive, and it's like a death sentence or a satanic figure that you are telling a common person from the slum. Yes.
40,000 shillings, just like that.
45,000
and above.
Yes.
Just for testing. And then you then put through these treatments. And the treatment itself, 3,600 times 25 sessions.
And that is a governmental facility.
And this is just a public facility.
Yes.
And then now there's the other issue. Now we're talking about public facilities. How many times did you go to a public facility and find the machine is broken, or we don't have the chemotherapy drugs?
Like right now, if I can be the voice, and that's why the reason I started the organization called Symbol of Hope Warriors. When I was doing the treatment, I haven't seen any brachytherapy machine. I have not seen it on a public facility. I've seen it on a private facility. And also we have these drugs. This is the month of breast cancer month, so I need to talk about breast cancer. We have this treatment called Herceptin. It's so expensive, and a lot of time we don't have it on our public facility. You need to go and buy for it outside the public facility. So like even right now, most of the machines that I know on our public facility, they are not working. I also do accommodation. I have a patient who I'm accommodating, and they have told the patient to go and seek the treatment at the private facility. And that is radiotherapy. And the public facility, they are paying more than 6,000 per session. the NHIF will pay a half of the money, and the rest of the money the patient needs to look for the money. You can see this patient they can't even afford a place to sleep. Where are they going to get those satanic figures to pay for their treatment?
So are we saying that there are people who may, because what I hear you saying then is that there are other people, other patients who may have this diagnosis and they are staying away from hospital, not because of anything else, but the cost of the testing and treatment.
Yes, and if it happens like you got the diagnosis and you were admitted. Yesterday I was visiting one of the facilities, and I saw this patient. They are doing the treatment because they are admitted. Because they are already on the facility, they cannot be denied for the treatment. But they are worried of the kind of the money that they are going to pay. And if you are not admitted, you are like an outpatient patient who needs to do the diagnosis. You can't do them. Like right now, our insurance is only paying two MRIs per year or 2 CT scans per year. If you need 4, you need to pay for the rest of the rest of the treatment, the rest of the test. That is MRI or CT scans. And if you are an outpatient, you need to pay for the rest of the radiotherapy. And if you go to the corridors, I was among the people who were sleeping at the corridors of Kenyatta Hospital on 2017. And if you go there, we have patients who are sleeping there until to date. And most of them, they are sleeping there because they don't have money to go back to their homes, or they don't have money to rent a room so that they can sleep at a safe place. And how are they going to get the money to pay for their treatment? So they ended up giving up, and some of them are committing suicide. Some of them, they are dying because of their mental health is at risk.
Dr. you talk about raising awareness, and one of the things that we then talk about then is prevention. Now, if we look at the side of health-seeking behavior, it's been spoken of, but is cancer then one of those things? Because we look at it as a non-infectious disease that can just kind of creep up on you, but is it preventable, really? Are there things that you can do? I know that today we're talking about the HPV vaccine for girls between the age of 9 and 14, which is of course laced with controversy and such. However, are those some of the measures that we're looking at then towards prevention? Is it something that we can say that, or are there certain things that you can do as a woman, looking at those 2 big ones, breast cancer, for which this month we commemorate, cervical cancer, the number 2 killer, the silent one, prostate cancer in men, another big one, pancreatic cancer. Are there preventative mechanisms that can be used towards this cancer?
Right. First is that cancer has no cause. And something which has no cause, there's nothing you can do to prevent or to control. Because cancer is not infectious. Cancer is a disease which each and everybody has got equal chance of getting it. What has happened, mostly in Africa and most in Kenya, is that what we have in Kenya is increase of risk factors. Cancer has increased because cancer is caused in a combination of so many things. And that's why we find when you come to cancer of the cervix, mainly the risk factor number 1 is human papillomavirus, HPV. So that's why the government thought that we should be able to give the girls the human papillomavirus vaccine, which is quite good. And then apart from the infectious, and that is the virus, the other risk factors for cancer of the cervix, and also cancer of the breast. The risk factors of cancer of the breast have raised in Kenya, and they'll continue rising up in Kenya. The same as all the cancer, pancreatic, prostate, stomach, and the common risk factors of all the cancers is mainly diet. The common factors of all the cancers is diet. And that's why we find that as Kenyans, we have changed our diet completely. We have left the African type of diet, and we have gone to Western type of diet. And that's what every Kenyan taking today even in the village. And that's why you find that unless we need to readdress the issue of diet, and of course diet comes with so many things, and that's why as Kenyans we need to think about what can we do to be able to prevent and control cancer, because the most important thing about cancer, it is prevention and control, and that comes with awareness. And that's why from the beginning I've said that we need to focus is mainly on awareness. And the way it is that the most important thing about cancer is early diagnosis, early treatment. Early diagnosis, early treatment. And that's why when we talk about awareness and screening, the most important thing to be able to start the treatment of this patient, we make early diagnosis and we do early treatment, because most of the cancers, when you diagnose stage 1, stage 2, the treatment is actually 100%. The cure rate is almost 100%. Even some cancers up to this time, like cancer of the prostate, even if you are stage 4 and you are given the right treatment, the cure rate is almost 90%. So that's a cancer which have got very good treatment irrespective of the stage. Of course, cancer is a predominant disease of many organs, and every organ can develop cancer. Like cancer of the pancreas, that's a cancer which is very difficult to be treated irrespective of where you are and irrespective of the stage. So some cancers which are easy to treat, others are very difficult to treat. But what is very important is that awareness, prevention, control, early diagnosis, early treatment, and most of what it means, and I said especially for this month, there are so many people who are willing to do screening without charging. It's very important that our people, our Kenyans, whenever there's any screening, just go to be screened. And the way I've said, and the way it is, that screening for cancer is very cheap. And screening for most of the cancers, you don't need even electricity. There are screening methods which are quite easy and simple, straightforward. At least they give you an indication where that patient is. And that's why at this time, what is very important is that we need to focus on awareness and screening. Awareness and screening, so that we can be able to get disease early. And once you get them early, it becomes quite easy to treat. Yes.
Is it possible that one of the reasons why health-seeking behavior is not as medical professionals would expect is what Millicent has just told us? The cost factor. Just the fact that, I'm feeling this, I'm feeling the other. I want to start any other alternative method of treatment for whatever I'm thinking I have before I go to hospital. Because going to hospital is going to be told, sasa utaenda kwa lab, uende ufanye, and you're... and that is going to cost you thousands of shillings, satanic figures, like you say.
The figures are not that satanic. They're just a bit high, but not very high.
If you want to do a comparison to what people are consuming on a daily basis, it's between two worlds.
Yes,
40,000 shillings just one test.
I'm coming to there. You find that actually most of cancer diagnoses, they're not that expensive. And I think most of the patients, most of the Kenyans have got NHIF, and most of the people now, they can go to, with that card of NHIF, they can be at least seen by the doctor without consultation with NHIF card. But of course, NHIF, the way Millicent said, that they are not paying a lot of things. Before, you used to pay everything. Before, you go to hospital, you are given the drugs, you are done tests without any expense from the patient because you got NHIF card. Even MRI, we used to send the patient for MRI and it's done without asking for any money. Now, NHIF is paying almost 40% of MRI. They used to...
In private or public?
Everywhere. MRI nowadays, you have to add something. That's from July of this year. Because in fact, I've been sending my patient before. They used to go and be done MRI, CT scan. They don't pay anything. Now, for MRI and CT scan, which is the accurate diagnosis of cancer, you have to pay something at this current time. Biopsy, which Millicent talked about, is very expensive. Cancer of the cervix, yes, it is. To make a diagnosis, it is first stage. To make a diagnosis, it is 40,000. Wow. So it means a lot for the patients. And that's why my personal appeal is that let the NHIF at least focus a bit on cancer. Focus a bit on the test before starting of the treatment. The tests before starting of the treatment they are trying, 40% is good. They are trying, but before they used to pay almost everything. By now they have reduced. But if they can focus on the tests, so that a patient with cancer is done the test and the NHIF can take care of that, that will make a big difference on actually saving lives. Because once you tell a patient that we will pick up when the diagnosis is made, and she does not have the money to do the first test, that patient, most of the patients actually don't make it. And most of the patients, what I've seen is that most of the patient they say, daktari, wacha niende nyumbani nikajipange.
Yes.
Anajipanga mwaka mzima. By the time anakuja, hata hawezi kukuja, analetwa. Because now the cancer has taken toll on him has gone down, there's no weight, and the cancer has gone to stage 4, in fact, 8 stage now, and it becomes very difficult. We find that actually, when the patient came to see me as a doctor the first time, the patient was talking, was happy, was having weight, and had no problem. And one of the most important things, actually, about cancer, which is very important, is that cancer is not painful. In fact, the major problem I have with the patients, especially when I diagnose very early, most of the patients don't accept they've got cancer because it's not painful. And that's why there's that notion in the public that when I've got cancer, I should have pain somewhere. Cancer is not painful until and unless it's in stage 4, and the last stage is when the patients start losing weight, they don't have blood, they start having pain. And that's the last stage. And that's why we normally say that cancer is a silent killer. It will eat you without knowing. And that's why some of the cancers, you can stay with them for almost 10 years in your body and you don't know. And that's why awareness will reduce this number of years when cancer is your body. And that's why we normally recommend people to be able to screen, to be screened. And screening will come only in awareness. And more so, we need more people, especially for the hospitals. I know screening for the cancer is not very, very expensive. They need to go out to be able to screen the people. And like us in the hospitals, also we believe in screening in workplace. Screening in workplace. It means that you need to screen people where they are working, because as Kenyans, cancer is not painful. To tell somebody, go to the hospital, you don't have pain, to go and see a doctor, and you go in line. So the most important thing is actually we need to get the cancer screening outside the hospital, outside where people are working. And that's us, of course, this I knew from my research, is that what we need to do is to screen people where they are. Somebody's going to church, and that day of the church, pick them in the church. And in fact, us as the hospital, we have picked so many people. You are going to church, you have been asked that there is cancer screening, and you will come reluctantly to be checked. Because pastor said, amesema, wacha niangaliwe. You go and check, let us cause cancer of the cervix, stage 1 or 2. Because stage 4, she will come to me. But stage 1, 2, 3, she will not come to me. Because it's not painful. And that's why it's very important. And like cancer of the cervix, it takes almost 13 years to develop. You have it, but the stages to come to know, it takes a long time. And more so, and what is very important, and also being a concern in Kenya, is that cancer is affecting our Kenyans when it's too early. In fact, in terms of age. In fact, like when, of course, most of our books we read from Europe, some people, when they come to Kenya and tell there's a patient with cancer of the breast, age 20, 25, they'll say, no way. You cannot, because in Europe, that's not but in Kenya, we're having patients, I'm talking about adult cancers from the age of 20 and 30. And that's why I've got a lot of problems. Because a young lady with the age of 22 telling her that I've got cancer of the breast, she'll say, no way, Daktari, I don't have cancer. That's a disease of the aged. And that's why we need to get awareness. And remember something very important, cancer can affect anybody at any age. Children have got cancer, their own cancers, and but my concern, children is okay, but my concern is the adults who are getting cancers very early in life. And when you get it very early in life, it's normally very aggressive.
What is your research saying? Why is this happening?
It's happening because of change of lifestyle in Kenyans. We have changed our lifestyle. Remember, it is the diet. It's the diet. But you just
said it's the same diet we're having like the Europeans, but the Europeans are not being affected at the younger ages. In Kenya, we have adopted that diet very fast, and we have got other risk factors, and risk factors are many. Like in Kenya, you find that our lifestyle are changed very fast now, and then you find that actually the food which we are eating, apart from the food, there is no control of our food. The sukuma wiki we are taking today is that it has not the way where it was grown, and the fertilizer it has been given, and the most of chemical had been sprayed. We eat that directly, and that's why, in fact, even in Kenya, you cannot export something in Europe which has been sprayed. You cannot. Even they are saying that they cannot get anything from us. The minimum residues,
which has been grown using fertilizer. They want to eat from us what is grown naturally. But as Kenyans, our Sukuma Wiki, we don't care where it's taken, where what was done. So we need, and that's why I do believe that to control cancer, we need, apart from the medical field, we need to go to other fields. And the most important field we need to go and go very fast is agriculture.
Source of food.
Yes.
Sure. Millicent, so where are you now in terms of your health? Recovered? They say it's in remission. Where are you now in this journey, and how are you feeling?
I still have a lot of side effects, and I'm still taking it one day at a time, and there is a lot side effect that I wouldn't love to talk about it like right now, but I just want to tell someone outside there, make sure your daughter has been vaccinated. Don't let them to go through what I'm going through. And if you are a lady outside there or a man, because even men can get breast cancer, make sure you have taken the opportunity of the facilities that are doing free screening, and do it. And if you have any girl between 9 to 10 years, you need 10 to 14 years, you need to make sure they have gotten vaccinated. I'm still continuing with my treatment because sometimes viruses are not treated, viruses are prevented. So I'm on managing situation, and I still have a lot of MRIs to do. I have some tests to do, so that I'm still
You're
on the
still
journey.
on the journey.
Yes.
Tell us about the symbol of Hope Warriors. How many members do you have, and what do you do as a group?
I started Symbol of Hope Warriors because of the love that I got at the corridors of the facility where we used to sleep together as we were doing the treatment. And my fellow patient really encouraged me. And I started the organization based in Kariobangi. Another big aim was to stop stigma, because I went through a lot of stigma. Even sharing the toilet with my neighbor was a challenge because of the smelly discharge, the smelly when I was on treatment. I was too weak. And I wanted to stop that stigma in the community, and I'm glad, like right now in Kariobangi, we don't have that stigma anymore. And Symbol of Hope Warriors, we are working with the patient, the journey, and also for those who can't afford a place to sleep when they're on the treatment, we accommodate them, and we continue with the energy of empowering patient and a survivor. Because even if we have the research team, maybe they need our story. We need to be on the decision making, we need to be on the table when they are making the decision as a survivor. Because if each time we are going to tell our Kenyan, we are going to tell the Kenyans, like we lose more than 9 women, or we diagnose 1,000 women to cervical cancer, but they are not telling us we have Millicent who is surviving the journey, and she's strong to overcome. So we are teaching the survivors how to own their story and how to share their story in the community, as we continue encouraging our government to focus on cancer and all other NCDs, because we are not ready to die, and no women should die of cancer, mostly cervical.
Very well said. Very, very well said. And I'm sure, who's the designate CS for Health?
Madam Nafula. Yes.
She has worked with Kemri. She knows the value of research. She should listen to what you've said. The person that Sakaja also appoints as a CCM for Health, and all the other county governors, they should listen to what Millicent is saying. Involve us and include us at the decision-making table, and listen to our voice. Asanteni sana for coming, Millicent and Dr. Geoffrey Mutuma. Thank you very much.